Hello, my name is Darlene Gilson, and today I'll be presenting over a few clinical tests that I performed as part of a lab um, for Chemistry 101 lab, and we also will be going over the patient history and the results of the clinical test. So now about the patient. The patient is a 45-year-old and 220-pound Caucasian male. He is 6'2" with a blood pressure of 135/75 and 50% hematocrit. He complains of abdomen swelling and puffiness in his face, as well as his legs. The patient also mentioned that he's now in a custody battle with his ex-wife, and he also mentioned that his appearance is very important to him as well as his career because he's in show business. Three clinical tests were performed using samples of the patient's blood and urine to assist in diagnostic analysis of the test. The clinical tests were glucose, enzyme kinetics, as well as urinalysis. In the next few slides, we will be going over these tests, what they mean, as well as the result from each test. So, the glucose test. The glucose test consists of three different tests, which are the glucose meter test, the Benedict's reagent test, as well as the reagent strip test. The glucose meter test is a drop of blood that was placed on the designated area of the test strip and inserted into the meter to measure the glucose levels. The Benedict's reagent test, a portion of the patient's urine sample was tested with the Benedict reagent to observe any color changes that would indicate the presence of glucose. And then lastly, the reagent strip test, which uses a small portion of the urine sample that was applied to the reagent strip to determine the glucose levels through specific color changes. So now onto the chemistry of these different tests and also like the value that it brings. So each of these tests, they uses an enzymatic reaction which involve glucose that results in a reaction to measure and correlated the glucose concentration. So now the results of this test. The blood glucose meter came to 100 milligram. The Benedict's reagent color was a light green, and the glucose strips was also 100. In conclusion, based on the three tests performed, the glucose reading was normal for this particular patient. The next test that we performed was the enzyme kinetic test, which is a laboratory procedure that measures the rate of enzyme reactions. So the tests, pretty much it was just the urine and blood samples. They were processed in a spectrometer. The result, we had two different results. We had the creatine kinase, which came back as normal, but the lactase dehydrogenase, with acronym LD, came back as abnormal. So the last test that we performed was the urinalysis, which of course using the urine samples. Multiple tests were performed using urine, which was a protein test, a reagent strip, also as an electrolyte panel. So for the protein test, an 8 milliliters portion of the urine sample was boiled and examined for the formation of a precipitate. If the precipitate formed after the initial period, acetic acid was added and the sample was boiled again. The next step, so rather than using a urinometer and cylinder apparatus to measure specific gravity, The lab had reagent strips that was also assessed pH at the same time. So a small portion of the urine sample was applied. And then the last test, which was the electrolyte panel, it was run for the patient. And then the electrolyte panel came back as abnormal, which meant that it was high and elevated. The reagent strip came back. The pH came back normal, and also the SG portion came back as normal. And for the first test, which was the protein test came back as abnormal. So, what was the final diagnosis? So, based on the different tests that was performed, the diagnosis is believed to be kidney disease. Kidney disease is kidney disorders that could come from edema, which is swelling. Like noted before, the patient was complaining of swelling and protein loss through urine, which might also lead to bruising due to changes in clotting factors. So the fact that the protein test came back as normal, that was an indication. Early on when we first saw the patient was complaining about some swelling in the face as well as the legs. This is the treatment plan that we recommend for the patient. The first one is dietary management. We are recommending the patient to manage his diet. We recommend him to be on a low salt diet to control the amount of sodium that he is intaking, and also to manage the potassium the amount of potassium that he's consuming. The next one is just to monitor in general. He will need to regularly test his kidneys to make sure that his kidneys are functioning properly. And lastly, we recommend an overall lifestyle changes. We already talked about the diet management. We recommend, as well as the diet management, to also exercise regularly.